Hello, my name is Ashley Baker and I'm going to be the student nurse today. I'm going to be performing an intramuscular injection. So I have received an order for vitamin K, ceftriaxone, 1,000 milligrams per 30 milliliters intramuscular injection. It is one dose. So right now I am in the medication room and I am going to be reconstituting my medication. So I will grab all of my supplies, which I have. I have already pre-filled my 10 milliliter syringe with my needle and my dose right here, the powder that I'm going to reconstitute. So let me just throw away my trash right there. And so I will apply my gloves and move my patient out of the way. Apply my gloves. But for demonstration purposes, I will not be putting these on because this is the only pair left that we can find. So I'm going to remove my cap of my powder. And for demonstration purposes, this powder does say 200 milligrams per milliliter, and it does say that I need to add 10 milliliters, so I will be doing that. So I'm going to clean my vial. And clean my vial. And then I have my 10 milliliter syringe, which I'm going to pull the 10 milliliters out and of air before I inject it. And I did do the 5 rights: the right client, the right drug, the right dose, the right route, and the right time. So, removing my cap, and I'm going to place the needle into the air area. And flipping it upside down and letting the medication fill. Again, we're going to 10 milliliters. And this is an IM injection, so I do have a 1 to 1 inch length needle, and I will be using a 21 to 25 gauge needle and at 90 degrees. So getting my 10 milliliters, and again, I'm not sure if I stated, but I do have gloves on. Pulling down to my 10 milliliters. Push a little bit of air. My 10 milliliters. Flip it back upside down. And I'm going to get my air bubbles out at eye level. And recap my needle using the scoop method. And I did already have this on here, but just want to clean it again. Now I'm going to take my 10 milliliters and I will place it in my powder. And I've placed my 10 milliliters in there and just going to remove my needle and my syringe, recap with the scoop method, and I would discard in the sharps, but for demonstration purposes, just going to set it to the side. So now I will begin rolling my medication in my hand, making sure to get all of the powder good and reconstituted. Rolling and never shake it. Just checking, and I do need to keep rolling a little bit. Rolling, and my liquid medication is clear. So now, since my order is 1,000 milligrams per 3 milliliters, I will get my 3 milliliter syringe. and open. And I will grab my needle that I'm going to draw out my medication with. Going to sit that down. Again, just want to clean my valve. And I have an order for 3 milliliters. So I'm going to draw out my 3 milliliters of air. And push my air in there. Careful not to put it in the medication. And then I will be flipping it upside down to draw my 3 milliliters. Making sure that it's drawing my 3 milliliters and flip it back upside down. Okay, and it did have a little spill, which is completely normal. Recap with the scoop method, just gonna make sure all my bubbles are out. Okay, so we did have bubbles, just removing those. And now I will remove this needle and discard in the sharps container. And then I will get my new needle that I will use on my patient. So now I have my medication ready. Again, all these would be in the trash. So now I will be going to my patient's room and perform hand hygiene and apply my gloves. I'm going to assess for allergies, and again, the 5 rights: right client, right drug, right dose, right route, right time. And this is an intramuscular injection, so I will be giving it in the deltoid, and we will never give more excuse me, than 3 milliliters. So I do have my 3 milliliters, so we are not exceeding that. So applying my gloves, and I will clean my patient's skin in a circular motion. And I did make sure there was no redness or heat, rashes, lesions, anything of the sort. I will be going in at 90 degrees, and this needle is a 1.5 inch needle, and you can use between a 1 inch and a 1.5. So being careful not to blow on my patient's skin. And my patient's skin is dry, so moving my safety out of the way, I'll be removing the cap and just going to secure my patient's skin, not pinching or taunting, just holding them stable. Going right in at 90 degrees and inject my medication. Going slow, but not too slow. Wait 5 to 10 seconds and remove. And then I would apply the safety device, but for demonstration purposes, I will be using the scoop method. And I will discard in the biohazard bin for safety needles. And then I will blot my skin and apply a Band-Aid, remove my gloves, perform hand hygiene, and come back and check on my patient in a little bit. Thank you.